Hello, friends. It's a great opportunity to be speaking to you. At this moment of crisis, which the world is going through, and our country is also in the midst of tackling a huge pandemic, it's time for all of us in the corporate world to reflect upon the strategies, the practices, the protocols that we have followed till date, to find out whether what we have done till now is something that we need to improve upon, whether we need to completely change them, or can we continue with some minor modifications and still maintain the robust growth rate that we were always proud of. Before I come to how the corporate world is responding to this crisis and how we are transforming the business processes to adjust to this new crisis, let me talk to you a little bit about the industry I come from. I have been in the health insurance industry for the last 20 years. And being in this industry, I have realized that insurance per se is something that our entire country has never given the importance that is due to it. If you look at health insurance, probably the only way health insurance has received some importance is that we get some tax exemption for buying insurance. Motor insurance, of course, because the government makes it mandatory that you cannot have a vehicle on the road without a motor insurance policy, but we still have almost 40% of our vehicles in the country uninsured. So 40% of the vehicles that run on the road today are not insured, and if there is an accident, if there is a mishap, the person or the victim is left out without any compensation. Yes, that there are other ways in which tribunals and the government have acted to help such victims, but insurance makes it much more easier to handle such occurrences. For health insurance, the entire focus of the country has been on social health insurance, where we believe that health is something that the government needs to take care of. We do not realize that our public health infrastructure is something that is not probably up to the standards that it should be in a developed or at least an emerging market. And that is very much evident in the current crisis. We have a public health infrastructure which probably is not able to support or is not able to give the amount of attention that it should do in such a crisis. If you look at our investments in public health, our total investment in healthcare as such has been less than 2 to 3% of the GDP. Yes, we have spent more on defense, we have spent more on infrastructure, but not on health infrastructure. It has never been a priority. Whereas if you look at developed markets, health itself, health insurance itself, is sometimes the major campaign criteria for a politician who is fighting an election. In the last few years, yes, our current Prime Minister, our current government has made it a priority that we look at social health insurance very closely. The investments have increased in it. But we need to have a system which can sustain the disease load of such a huge country. Our healthcare workers, no doubt, are doing their best, but they can do to an extent that the infrastructure supports them. When you don't have enough beds, when you don't have enough doctors, when you don't have enough nurses, we can pull on up to a certain level. And yes, that's where the private healthcare comes in. Private healthcare in our country has grown in a manner where it probably serves a certain section of the society. If you, the most common term that you would hear these days is lifestyle disease. And I personally believe that what we should have cared for in the public healthcare system is to take care of people's life. There was surely a method of life, there was surely a way of life which our previous generations lived, and a public healthcare infrastructure took care of it to a certain extent, of course. But now, with this new term of lifestyle, that we have added style to life, our corporate healthcare, our corporate hospitals, our private hospitals are mainly catering to that style and not the life. So when we use the term lifestyle, we never realize that yes, there was surely a way of life earlier. What has happened now that the disease burden has increased? What has happened now that the entire demographic pattern has changed? What has happened now that we see an increasing trend of cancers, an increasing trend of transplants which are happening, organ transplants, an increasing trend of hysterectomies? Almost for all our deliveries, we see that cesarean sections happen. Normal deliveries are rare these days. What could be it? Is it just a coincidence, or is it something that we have actually institutionalized into this system? So corporate healthcare does exist in a big way, but does it serve the population? Something that we need to ponder upon. Let us also think about whether insurance, which is supposed to protect the population, is doing its function properly. So, health insurance has developed in this country, yes, to a much better extent now what we saw a decade ago. Thanks to the policies of successive governments, the regulator, we have made health insurance now accessible. But a big question mark is it affordable? When I say affordable, yes, you cannot have health insurance accessible and affordable to all the masses at the same price or at the same quality also. We need to differentiate what kind of quality is required for what kind of diseases, what kind of treatment. And price is something which probably needs to be taken care of through some kind of social cross subsidization. The well-to-do class, the rich class, needs to understand that they need to play their role by insurance. And if that middle class, upper middle class, the rich class have insurance, good insurance protection, and utilize private healthcare, we can surely utilize public healthcare for the bottom of pyramid population. And that is something which is essential. We are moving towards it. The insurance market is deepening, and we expect that the general population will realize after the coronavirus pandemic how important this is. We are receiving instances every day where a certain family is helpless because they don't have enough protection, and at the same time private healthcare would not spare them the cost that is being incurred towards coronavirus treatment. So as a society, we need to understand the importance of insurance. As a society, we need to encourage everyone to buy insurance. And as a society, we need to ensure that we make it affordable for our unprivileged section of the society to get insurance coverages. About the new normal that we all are facing, yes, the corporate world will move to a completely digital working style, more work from home, less office spaces. But at the same time, we need to think that whether this new normal is something which will affect the mental health of people. Will it give rise to a new set of diseases after coronavirus goes away? Will we need to deal with a new set of problems after this pandemic is eliminated? Something that we all need to ponder upon. The most important factor, at least in healthcare, is that human touch, human empathy cannot be replaced with any extent of technology or digital interventions. And this is something we all need to realize and understand. With increasing technology advancements everywhere, even in healthcare, you would have heard of robotic surgeries, you would have heard of doctors using more and more equipments and robots and chatbots in all kinds of treatments. But yes, that is required. That is required if it improves recovery rates. That is required if it improves success rates. But it does not take away the importance of the human empathy that is needed. Nursing care cannot be replaced by a robot, howsoever hard we try. And that's why, personally, my concern always has been that whether we are moving towards an era of digital empathy in healthcare, which will take away human empathy and probably bring in more problems for us than what we are seeing now. So, in all our professions, we must ensure that we maintain that human touch, that human empathy, even if we move to a digital world, that social inclusion, being empathetic towards our colleagues, understanding problems, and not just be focused on a corporate objective is something that we all need to bring into our working style. And lastly, I think for the corporate world, all of us need to understand that yes, there is an economic or a fiscal motive to every business, but at the same time, we need to understand that business has to be with a purpose, and that purpose cannot be only a profit motive. It also has to be human well being, it also has to be social inclusion. Thank you very much.